My name is Michael Malin, founder and CEO of Stasis Labs. It was 2012 and Stasis co-founder Dinesh was in the hospital with his grandfather. His grandfather was in the ICU, but fortunately starts doing better, so they transfer him to the general area, where Dinesh, who's a trained EMT, is sitting right there next to him. In the general area, nurses do routine checkups every 4 to 6 hours. In between check-ins, his grandfather starts deteriorating, but nobody knew. By the time that they found out, they tried to stabilize him, but unfortunately it was too late. He passed away. At this time, Dinesh and I were studying biomedical engineering in University of Southern California, USC. What kind of infuriated and shocked us so much were there were doctors in the building, nurses on the floor, trained EMT right there next to him, but no one knew. There's this clear information gap between how the patients are doing and what the nurses and doctors knew. So we started trying to understand, why does this problem exist? Well, we were so surprised to really learn where that only top medical institutions actually had access to these types of connected monitoring solutions. And this is because the existing solutions require a lot of infrastructure and resources and upfront capital to be able to implement them. So what we did was set out to create a plug-and-play monitoring system that was accessible for everyone. We built out a small little piece of hardware, which you can see right here, that monitors 6 core vital signs. All that information goes to a tablet that acts as the controller. The numbers, the waveforms, trends, everything is right there. And all of that goes up to our cloud. Any phone, computer, tablet, TV, anything can display how all the patients are doing. Now the nurses and doctors can see which patients need attention, and they can go and intervene before a tragic event happens, like what happened to Dinesh's grandfather. So we started building this out and launched it in the Indian healthcare system. And the thesis was, let's make sure that we don't require to wire up beds with Ethernet, require on-prem servers, require EMRs, require IT teams to implement and manage it, and not require a large capital budget to be able to do a project in the first place. And that's exactly what we did. And in fact, I'm proud to say that across 65 installations, it's never taken us more than 1 day to install, train, and go live. We've provided care in India for over 30,000 patients and have collected over 1 million hours of data to start building different predictive algorithms to know even earlier when an issue might be coming up. In March of 2020, when COVID-19 was ravaging the world, we took action. We started partnering with different government agencies and private institutions over in India to provide care and creating COVID isolation rooms. We also launched in the US market, working in a big COVID hotspot, Texas. There we installed in medical trailers, tents, and even in overflow parking lots in patients' cars to make sure that the staff knew what was going on, but were able to do so from a distance to keep themselves safe from exposure. Moving forward, we are continuing to provide support for facilities while also bringing our solution into the home to make sure that patients can get care from their clinicians, even while doing so virtually. Thank you.